These health experts have gathered to discuss strategies to stop the transmission of HIV from mother to child and the treatment of babies born with the virus in Nigeria.
Globally, the trend was decreasing, but Nigeria's one was increasing. And the mother-to-child transmission was still at about greater than 20%.
Most times, we were on strike. The government facilities were not working. So, cases identification as regards to pediatrics, we are in trouble.
A look at the statistics of pediatric HIV in Nigeria as of 2020 shows that at least 30,000 children were newly infected with HIV, or one child in every 2 minutes, according to UNICEF. In addition, another 120,000 children died from AIDS-related causes during the same period, or one child in every 5 minutes.
The Federal Ministry of Health is determined under the leadership of the Honorable Coordinating Minister of Health and Social Welfare to ensure that the key gaps that we've identified over the years are being addressed this time around. Part of this is to ensure, in terms of HIV, to reduce the rate of infection amongst the children and also reduce the mother-to-child transmission.
Representatives from different states speak on efforts to tackle pediatric HIV in their states.
From the mapping exercise, we were able to map about 600 in Delta State, and through the Delta 2 project, they were able to facilitate training of over 150 traditional birth attendants, which I would say is a huge gain.
Having worked with funding from CDC and in Benue State, where we're implementing the AP3, we really appreciated the impact or the input of the organization in our work.
Under the mandate of Tinubu's Renewed Hope agenda, toolkits have been developed to identify children born with the virus. This could slow down the number of deaths from pediatric HIV infection.
We have to look at it from the national perspective, looking at the 37 plus 1 state. Once this is over, we'll use the toolkit, we'll call a bigger meeting, not just a dissemination meeting now, an implementation meeting on how we can roll this out across the state.
More targeted funding, targeted for children and adolescents, targeted for pregnant women needs to be attracted into Nigeria. So we are moving towards getting to epidemic control, but there's still a lot that needs to be done.
The federal government, in its efforts to combat pediatric HIV infection, tuberculosis and malaria, recently released $933 million. This fund is to help in the treatment of the virus and other diseases and vaccination for other ailments in the 36 states, including the FCT and enlightenment programs for more Nigerians on pediatric HIV infection in the country. Olije Wapera, Arise News.